It's another day with the physicians where your health is our business. Growth spot to end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the Training Culture of your regular program.
And at 2%, you will feel the kind of heat that you will feel right now.
It's so hot. Menopause occurs when a woman hasn't menstruated in 12 consecutive months and can no longer become pregnant naturally. It usually occurs between the ages of 45 and 55 and can develop before or after this age range. It can cause uncomfortable symptoms such as hot flushes and weight gain. Every woman's experience is unique, but what are the conditions that tend to increase the severity and duration of symptoms? Let's hear from our guests on today's episode on your regular program, the physicians, as we discuss menopause, the causes, presentation, and management. It's another day with the physicians where your health is our business. Today we'll be discussing menopause, the causes, presentation, and management, a topic that actually makes the women feel very uncomfortable. And some women get excited that at least want to talk about it. Why some don't even look forward to having it or experiencing it at all? Why is it so? Even when you are in an air-conditioned room, it's like you are in an oven. Well, my name is Dr. Martina Agbemi. As usual, I'm not alone on this program. I have my very elegant, beautiful co-host.
I remember Dr. Memuna Yusuf Kadri. It's always a pleasure to be here.
We're talking about menopause. Don't look at me, I'm not sweating. Because I know where your mind is.
I didn't say anything. She said I should not look at her. She knows where my mind, our mind is. The truth is, we know what the answer is.
Well, menopause, Mimuna, I'm sure you're looking forward to having it, experiencing it.
Yep.
So let me tell you something. Why some people don't look forward to getting to that stage, some actually look forward to it. You know why? Some say they are tired of having every monthly
flow. It's very, it comes with a lot of discomfort, inconveniencing. Sometimes you are messed up. No.
But then we'll have to now weigh the pros and the cons. Menopause, yes, it's bound to come.
Exactly.
The challenges that come with it, I think if one is well prepared, psychologically.
That is what it is. For me, no woman should hate it. It's going to come.
It's actually a process.
It's part of you. It's not
being
of
a woman.
being a woman. You attain menarche, which is your first menstrual flow, and you are so excited. I'm not a woman. Now you are no longer going. Being menopausal does not make you less of a woman. It makes you more of the woman who you are becoming.
Okay, let me ask you something. Why is it that we talk more about the menopause than the women and the men? The men have andropause.
Andropause, yeah.
The men also have andropause.
It's still the way the society views those things. Women wahala, women issues. I know we need to talk about this andropause because when that andropause comes, you see some of the men wearing shorts.
Yes.
Wearing glasses.
Feeling young.
Feeling young and being hey, you know what it is.
When we come back, we talk more about menopause. And of course, take a sting at andropause. We'll be back after the short break. Don't go away. you have just joined us on your regular program, today we'll be talking about menopause, the causes, the presentation, and management. And with me in the studio is a renowned obstetrician and gynecologist. He is the MD, CEO, Louis Med Specialist Hospital and Fertility Center. He is Professor Akinloye Bamigboye. Prof, you're welcome to our program.
Thank you. Good day, and I appreciate you coming.
You're welcome, sir. It's always a pleasure having you.
It's always a pleasure having you here.
Yeah.
Nice, nice. So we're talking about menopause today.
Okay.
But before we go to the nitty-gritty, do you want to just tell us about a general overview? What is menopause?
Menopause is generally defined as waning ovarian function. The ovary functions normally, but when it wanes, which occurs when the age is coming on, the menopause comes in. The function of the hormones that are produced by the ovary are diminished. And then we have less estrogen, which is the most important hormones there, is waning in function, and until it stops at the age of 53 or 45, as it might be.
Interesting. So that means we have people as young as in their 40s being menopausal, as against that norm that you have to be like 50 or 60s.
Yeah.
So it's just for us to just know that, look, just follow the rule.
Yes.
When you stop having period for at least 1 year, that means your menopause is just around the corner. So, but are there predisposing factors and causes of menopause?
There are definitely genetic problems which one would see, because if you look at it properly, if a woman, you can actually predict a woman's period by the mother. If the mother menopausal earlier in life, then she might also end up menopausing earlier.
Oh,
so
seriously?
that's the genetic, yeah. We do have that. And again, we have the environmental factors. People who drink a lot, will definitely have the influence of the alcohol affecting the ovarian functions. So it is like that. Or people who are obese, they will definitely have a decreased, period of exposure to to the ovarian hormones, and then they may menopause. People who smoke, that's another factor. They will end up having menopause a bit earlier. And people who take a lot of caffeine, coffee for this, coffee for stress, anxiety, people, the anxious people, they do have premature menopause or even menopause a bit earlier than usual. And then what you mentioned also is pertinent, that some people who actually stop menstruating menopausal at less than 40 years old, they call it premature menopause, and it's a disease on its own. Yeah.
Okay, so premature menopause, which is a disease on its own, those that usually would experience it earlier.
Very much
earlier. So, and you said something that is very significant, like a genetic factor. If the mother experiences it earlier, okay, the daughter is also at risk of having it earlier. Is it, for instance, let's say the mother experienced it at like age 45? Are you saying the daughter is likely to also have around 45 or lower than 45?
Yeah, if a mother experiences menopause at, say, the age of 40, let's use 40.
Okay.
The patient, the index patient, would definitely menopausal at about that age. So if a mother experiences at 50 years or 54 years, then you can expect that woman to go on as well to that age.
Okay, that one is better. It's good to hear that, because I don't want to hear where the mother at 50, the daughter now goes at 40, at 48. They get to a stage where you are reducing.
It could be why, if the mother became menopausal at 50, but wasn't drinking, wasn't smoking, those other factors, the daughter may come earlier. It may be the daughter is obese, if the daughter drinks and smokes. So some other compounding factors may make the daughter have menopause earlier.
That is a mixture. What you are saying is quite correct. It's a mixture of environment and the genetic.
Exactly.
Yeah. So it's possible.
Okay, so fine. You already talked about the risk factor, that the predisposing factors. to alcohol,
Caffeine.
tobacco,
Yeah.
obesity, a lot of other conditions.
Yeah.
Now, how will an individual who is menopausal, okay, present? Or maybe you want us to just even talk about the types, the pre, the peri, and the post-menopausal. You want to talk about the types first?
Yeah, you see, essentially we have pre-menopausal, perimenopausal, menopausal, and post-menopausal.
Good.
Yeah, those are present in different manner, but they are also a spectrum of the same disease entity. So a woman with perimenopausal or menopausal symptoms might have issues with the. It's very easy to look at it in terms of the picture of the woman, the head. So in the head we have people who normally will have headache, who will have insomnia, not able to sleep properly, who will have visual problems, not seeing properly.
Okay.
There will be issues of not remembering things. You want to check
Wow.
your friend's name on the phone. You are, what is his name? Is it Helen? Is it John? That kind of a thing. So those are features of menopause. If you look at the woman, you want to screen a picture, then you are doing squinting. You're trying to struggle. Those are menopausal symptoms. You look again at the neck. You cannot sing properly. Normally you sing like Oprah Winfrey, or I don't know who sing again. I don't know who. Mali, and then you see my voice, baritone voice and terrible voices. So those are the things that will show that this woman might be menopausing. Lots of voice. Okay. Then you go to the heart. Then you see the heart not beating properly with palpitation. You are hearing your heart moving. Then it's a good sign that there's a problem here. Then you go down again. You look at the bones of the body. The bones are getting weak, subtle, and then it means the calcium is not okay. Then you start wondering what is going on. Then you go again, look at the stomach. The person who's menopausing will be full easily. Will not want to eat the way it used to eat before. Then you look at the other things in the intestine. Constipation is there. Obesity is there, and so on and so forth. You look at the bladder. You are not able to hold urine easily. It's painful. It's frequent. And there's the urge to pass urine, urgency.
All these are menopause.
Menopause, yes.
Like one who is diabetic.
Like somebody who is diabetic, and then you can actually come up with obesity, with heavy weight. You have a BMI of.
Meanwhile, you're not eating.
Meanwhile,
you're
not eating. Yeah, so it means the rate of metabolism is decreased, is low, and then you accumulate fat.
And the wrong places.
Yes, and at the wrong places, and when you have accumulated fat, it affects your cardiovascular system. Blood pressure comes in, okay, and then other issues. Then you go to the genital part, where you have issues with dryness. The vagina is dry. You don't have interest in sex. Lots of libido.
So it becomes painful.
It becomes painful, and then when you have all those, then you start thinking, oh, there's something wrong.
When we come back from break, we'll discuss more. So let's hear what you have to say about menopause and keeping up with the physicians. We'll be back after the short break. Stay tuned.
Menopause is a stage in a woman's life when the progressive age of childbearing got to an end. In most cases, some people, their monthly menstrual flows usually ceased. Well, I started having this menopausal issue in my 40s. In my late 40s, I usually have internal body heat flush, insomnia that at times I'll wake up, I won't be able to sleep 3-4 hours during the night. So at times I'll be feeling dehydrated. Then at times the monthly flow will come heavily, or at times it will come scantily. So it has different, it depends on body genes. Everybody doesn't have the same symptoms.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We've been discussing menopause, the causes, the risk factors, and our consultant here, a consultant obstetrician and gynecologist, Professor Akinloye Bamigboye. He actually has been doing justice to this program, to this topic. He's been telling us really not lots and lots of symptoms, the risk factors, how you will know that one is menopausal. But then, before I ask him to continue, if you are alone watching this program, a husband, please call your wife. Let her join you. And if you're alone as a woman, as a wife, please call your husband to join you. Even your sons, let them join you, because it is something that everyone needs to hear about. So, Prof, we're talking about the symptoms. You've actually started from the head to the neck, the chest, the abdomen, and now you're going down. Please, can you tell us more about these symptoms?
Thank you very much. What the producer has said is very valid. It's very apt. Let the men also join to listen to this topic being discussed. Because men are the partners of the women who would then see the way they're presenting. Imagine your wife comes from office and start fighting for no reason. No, the man will react. Yeah. But the point is, the menopausal things are actually what is on the ground. Mood swing, and after that they are very happy. I start wondering, why is this woman so sad the first time I saw her? Now she's happy. Don't be perturbed. It's because of the waning ovarian functions that she has got. The hormones are not there. They are decreased. So that is one. Another thing will be the hot flashes.
The hot flashes, yeah.
Hot flashes is very common.
I hate it.
In the villages, people would say, "Oh, that woman is a witch." That when everybody is cold,
she's sweating.
She's sweating. When everybody is sweating, she's cold. No, it's kind of a nightmare. It's a rigmarole, kind of, and they would ascribe witchcraft to the poor woman because you do not understand, and that is it. And then also, because the menopausal features really affect the heart, they may start having palpitations, as I've said earlier on. The BP may be high. They may then even the mood swing, which I said, it could be worse, and they get depressed. Imagine you have this bipolar depression. One time you are very happy, the other time you are very sad.
For no reason.
For no reason, yeah. So if you see your mother shouting at you, you must take note that, look, there must be something wrong with the hormones, which is natural, because it's a natural phenomenon. It's a phase of life. It's not something that is induced because of yourself. It's because of the nature. It's the phase of your life. So that's why we tend to also do the blood pressure things. The blood pressure must be monitored to ensure that the BP is normal. The cholesterol should be checked to ensure that the cholesterol is normal in any woman who is in menopause. Those are the things we do.
So aside from this clinical manifestation, these laboratory investigations are also key from what we are discussing now in arriving at this person is actually going through menopausal phase, and then we are dealing with menopausal symptoms as against XY. So ruling out other kind of medical conditions with regards to nipping it on board that this is menopause. Now we know this. We know the causes, those that can easily be predisposed, the different stages. How do we manage women that are menopausal, or even preparing them for this menopausal phase and the management?
Thank you, Dr. Producer. We definitely ascribe special clinics to women who are in the menopause. It is not routinely done in Nigeria, in most places, but that is the ideal. That is the sine qua non, because among the Western world people, in the first world, they will ascribe special clinics to them, and that is part of the management, whereby you do blood tests to assay the blood. When you assay the blood, you can see the trend of what you are doing. Are you doing well? Is the woman getting better or not? You can do that. you want to do what we call DEXA bone scans. DEXA bone scan will ensure that your density of your bone is known. Then you compare it to
so
the
they
next
don't
bones.
have fractures.
So that you don't have fractures, because they are prone to having fractures. Menopause, they will have fracture, they will have joint pain, they will have ankle pain, and so on and so forth. So you do DEXA bone scan. You can do calcium in the blood. You can advise them to get into the sun if this calcium is low. There are so many things you can talk about: fruit, diet, egg, and so on and so forth.
What do you egg? What
would the egg be?
Oh well, going to get protein from the egg. We're going to get some vitamins from the egg.
So you encourage them to take egg.
Some of
It's good.
them. Okay.
An egg a day or 2 eggs per day?
Oh, I think even one is okay, but you don't run away from cholesterol as well.
Exactly.
So you have to be very careful.
So is it full egg or you add
Yolk or what?
No, and I've been brought into this quagmire of egg and egg, okay? But egg is egg and it's egg. Because you need protein. Women at that age, they start losing protein.
Too,
Their muscle bulk is going down gradually. So they still need protein to supplement that.
Okay, now you talked about the management, right?
Yeah, yes.
Okay, I want to just ask something. I want to know what is the duration if one starts, the premenopausal, menopausal post. When it starts at 45 or 50, when is it expected to get to the end, when the woman stops going through all this?
In my clinic, the women have asked that question severally, and it is basically to tell them we do not know when you are going to stop. Depending on the history that you have taken your history very well. When did you stop? When did your mother stop out symptoms? But then if you don't know, but generally speaking, it's like a couple of years, 5 years, everything is gone. So once you start it, then you should be able to stop it in the next 5 to 10 years. Yeah.
Okay, somebody will tell you there's a early menopause.
Yeah.
Okay. At 40, 38, is it different? Is there any other health condition that can make somebody have not see her period?
Yeah,
if
you are exposed to oncology drugs, anti-cancer drugs early, you might end up with menopause early as well. That is one important factor. If you have surgery of the ovary, like getting some of the vessels that supplies nutrients or food to the ovary, you might end up with early menopause. Okay. If you have an infection of the ovary, that could also result into early menopause. So there are a lot of things that can cause that.
Okay, fine. So, Prof, sorry, I want to just ask you this: for women who probably had surgery, let's say ovarian. Yes, totally. Okay. And they now you have just exposed them to having early menopause. They will still go through all these symptoms that you talked about.
Yeah, definitely. If you do hysterectomy, which is very common, so that's a good question. Thank you. Menopause, every woman will tend to be careful. Oh, I don't want to remove my womb because I'm going to end up with premature menopause, which is actually a fact. But once you tell them about it, the reason why you are removing the uterus, and then you tell them the menopause, then you conserve the ovaries, because doctors may tend to remove the ovary at the same time. Okay. But if you don't do that, you remove the uterus, you leave the ovary, then most likely the ovaries will still work. Okay. In fact, more than the normal age, because they've seen ovaries working till 60 years old. Okay. Yeah. Okay. So we're still going to leave that.
So what is the role of hormonal replacement therapy?
Exactly.
Okay.
Do you encourage it?
The nomenclature has changed a bit to estrogen replacement.
Okay.
But yes, but most of the doctors at home will understand that hormone replacement is the in thing. But then there are controversies. There have been controversies for a while now. Estrogen, which is the waning factor of the ovary, is to be replaced to be able to manage this condition of menopause. Okay. So replacing the estrogen, you have many methods of doing that. And then if you are somebody who is very natural, and you are careful not to stimulate cancer of the breast because of the exposure to estrogen, or cancer of the endometrium of the womb because of the exposure to estrogen, then you might advise the woman to use natural method first. And natural methods include the use of phytoestrogens. Phytoestrogens, is plant estrogens. So that kind of estrogen should be able to replace the estrogen that are lost with age.
Okay.
And then we have other food that can cause soya beans and so on and so forth.
So I think the role of the counseling generally is very important, and for our viewers, they will also let them know that it is good to share. If you are going through menopause, your husband needs to understand also. Prof, I have to just say a very big thank you for coming on our program, The Physicians, and we're really excited. I'm sure when we call again, you'll be back here.
Thank
and
you
for our
very
viewers out there, you've heard it all from him, the symptoms, everything about menopause that comes early, if I see from the head to the toe, the head, a lot of things he talked about, hot flushes. So husband, even the wife, please try and as much as possible to let your husband know what you are going through. If you understand what menopause is all about, all those nagging, all those hot flushes, snapping at every moment, going into mood swings, he will appreciate you better. But if you don't tell him this is what you are going through, he won't understand that it's a hormonal thing. So you need to share. So husbands and wives are also listening. Please encourage and support one another, because it's a phase that one must go through. When the females will have to just go through it. It's a natural phase. So thank you again for sticking with us on your program, The Physicians. I am Dr. Martina Agberian.
Thank you very much. Menopause is a phase that we must all encounter as a woman. But the most important thing, knowing that this must come, is to ensure you build and develop the healthy mindset towards that period. So when it comes, it doesn't make you feel less of who you are. For the men out there, we love you. We know your support is always very important when it comes to it. Our sons, our brothers, our fathers know the woman is more valuable as she gets older. Wisdom and of course experience. Support is very key, and counseling is ultimate at the end of the day. I remain Dr. Memuna Yusuf Kadri, and please kindly follow us on all our various social media platforms. And if you would like to be part of this program, you are just a click away. Till next time, stay blessed.
Keep watching The Physicians. You will be intrigued at the kind of information you hear all the time.
The truth is that the only cause that we can't prevent is the in utero cause. That is not even all. Some are preventable with proper